Hi, are you Anne?
Yes.
Hi, my name's Lydia. I'm a level 1 nursing student.
Hello.
And I'm going to be with you with this patient today. Do you mind giving me an SBAR?
Sure. So I have patient in room 529. Her name is Martha Young, 80 years old, Hispanic female. She is assigned to Dr. Stephen Jolie. She has no allergy. She is full cold. She was complaining about a non-healing sacral ulcer stage 3 of 3 months duration. She has been treated with as an outpatient without success, and she was admitted from the physician office. Her family history is unknown. For her past medical history, she has a history of multiple admissions for dehydration and pneumonia. Last admission was about 6 months ago. She doesn't smoke. She has no history of heart disease or other chronic illness. The patient's last menstrual period was 30 years ago. She had 4 pregnancies total and 1 abortion, and she has 2 living children. She is widow female living alone in a senior housing apartment. She has 2 adult children live out of the state, and the patient rarely sees them. So she is currently taking Senosize for her constipation and acetaminophen for her pain. So when I review her chart, her skin, I noticed non-healing ulcer at the sacrum, complaint of dry, scaly skin. She used lotion occasionally. The breakdown started 6 months ago after previous hospitalization. She is slightly hard of hearing. Occasional watery eyes. Patient is on regular diet. She reports decreased appetite, no complaint of nausea, vomiting, or change stool pattern. For her GI, she complained of occasional stress, incontinence with nocturia. She also complained her lower back pain, aching quality for the past 3 months. So this pain usually relieve when she takes the acetaminophen. She used walker to get around, and she also complained of generalized weakness and fatigue. She had her last pap smear done 10 years ago. So for her physical assessment, she is general. She is alert oriented. Her last vital sign was taken at 14:15. Her blood pressure was 144/90. Heart rate was 88. Respiration 24. Temperature 99.1. And O2 stat 92%. Her skin is frail, thin, and thin, intact, except the sacral wound. Involvement of surrounding tissue is kidney shape. She has several yesterday without unusual odor. No undermining, tunneling, or bruising. She has poor skin turgor, and her vision is 20/40 bilaterally. Mucosa is pink, no without lesions. Her heart is sinus ramp with occasional premature beats. Chest expands symmetric. Lungs are clear to auscultation in all lobes. And her GI is soft, non-distant, non-tender, slightly obese, no masses, active bowel sound in 4 quadrants, cranial nerves, 2 and 12 intact. Motor and sensory examination of the upper extremity is normal. Reflexes 1+, symmetric bilaterally. So I noticed some abnormal labs. Her hemoglobin was 12.1 low. Her hematocrit was low, 37%, and she has an elevated white blood cell count, 12,500. And her blood culture showed that she has E. coli, gram-negative ROS. Her albumin is low, 3.2. Her bond is high, 22. And she has a peripheral IV 20 gauge in her right arm. So the doctor ordered some meds, some antibiotic, the gentamicin, to treat her infection.
Okay.
And some normal saline with potassium chloride.
Okay.
So her plan is to increase nutritional protein intake, dietary consults, and plan to sacral wound debridement tomorrow.
Oh, okay.
Yes. So do you have any question for me?
I do actually. So you mentioned she's getting medication. Why specifically is the client receiving this medication?
The patient has elevated white blood cell count, and the blood culture shows she has E. coli in her body. So this show the sign of infection. So the medication is an antibiotic, was prescribed to treat her infection.
Okay. And what action does the medication have on the body?
The medication binds to the bacterial cell wall and cause cell death.
Okay. When should you question administering this medication?
So I will review her charge, make sure she doesn't have any kidney disease, any hearing problem. If she was prescribed with any other different medication, I would double check, make sure there's no drug-to-drug interaction.
Does the medication have a therapeutic serum level?
Yes, it's 5 to 10 milligram over a milliliter.
All right. And which vital signs must be monitored?
I would monitor all her vital signs, especially her respiration, because it could cause breathing problem.
Okay. And which physiological parameters should be monitored when the medication is being administered?
I want to assess her level of continence, her intake and output. If she have any problem with when she's urinating, or lower output, hearing problem, or any allergic reaction.
Okay.
Yeah.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So in the hospital, I always want to make sure to review the medication, make sure there's no drug-to-drug interaction, and make sure the patient knows she has the right to refuse the medication.
Okay. And what interventions must be taught for teaching the medication safely at home?
So the medication usually given in the hospital setting, but if she is prescribed this medication at home, I would recommend she use exactly as direct and use it at regular interval. Do not skip doses or stop medication early. Do not share this medication with others, and she would also want to watch out for any side effects, which is rash or itching.
Okay. What are the side effects and potential adverse reactions?
So this medication can cause trouble passing urine and lower her urine output, breathing problem, hearing impairment, confused, dizziness, and allergic reactions.
Okay. I think that's all I have for right now. Oh, I'm sorry, just kidding. There is a few more questions. how will you know the medication is effective?
If she show no signs and symptom of infection.
Okay.
Yes.
Okay, that's it.
Okay. So you ready?
Yeah.
Knock, knock, knock.
Come in.
Hello, my name is Anna. I'm your nurse today.
Hi.
How you feeling?
Good, how are you?
I'm good, thank you. I wash my hands. So, I got the lab results. It showed that you have elevated white blood cell counts,
Okay.
and you also have E. coli bacteria in your blood.
Oh,
So the doctor ordered some antibiotic for
Oh,
you
okay.
to
Cool.
treat your infection.
Mhm.
So he ordered gentamicin injection and some normal sodium chloride with potassium chloride. So are you ready to take your medication?
Yeah, sure.
Do you have any pain right now?
No.
Okay. Put on my glove. I'm just gonna raise the bed up, okay?
Okay.
Okay, that's good. Is that good enough?
Yep.
Can you verify me your name and date of birth?
Marta Yam. I'm not 80 years old.
Do you have any allergy?
No.
No. Okay. Oops. Sorry, it didn't go through.
Okay.
Just scan again.
Did you document your teaching? You sure? Did you save the answer?
Sometimes it doesn't work. They usually have me read my number
mind
off.
reading?
Yeah, that's fine. It's gonna be 5940905652.
Let me just take a look at your IV site.
Mm-hmm.
And before I do any injection, I will flush the IV site.
My back is in my first part that I used to counsel with, and then
So I clean it
Mm-hmm.
for 15 seconds. Oh, no wonder why. Have to unclamp it first. Okay, so it looks good. No swelling or anything. No redness.
Okay.
So this is the sodium chloride, just like a regular fluid.
Mm-hmm.
I want to make sure I got the right I want to compare to the mall. I have the right gut,
Just the part where
right bra, right dose, right path, and right patient.
Okay.
And it's not expired, and the color is still good. No discolor, no leakage, anything. Open my tubing package.
Oh, there it is. Okay. You ready?
Open this. Remove this. Open this. Make sure this two spot is sterile.
What does she get? Does she get normal saline?
Like, scan my medication.
I got a copy of the video. Don't turn the computer off.
I think there's something wrong with the scanner, so I'm just gonna type it in.
Okay.
Sorry.
That's okay. The scanner has been working all day.
Hey, it was flush for me.
You want to know the peak duration?
I need to write it.
Oh, I didn't have Okay, got it.
So the peak, IV is round. Well, the onset cutoff is the peak is in the
So we hang this here.
side effects, procedures, anesthesia,
Squeeze my chamber halfway. And turn on the system.
With one of the drug cases, just make sure that you
Cram my tubing. Make sure I close this. And then now I open it and cram tubing.
Wait, what's the rate?
To get all the bubbles out.
Oh, is there a serum level? Oh, there's one that has a serum level, but already overgrowing.
Yes, sir.
No, it's so good. I've never had anything, I've never known anybody that totally like freaks me out. Do you like Hebrew labels or you don't? These? Did you want to use some labels?
Let's go here.
Yes.
It's there. Mostly there's something
This time I'll change my answer.
Channel select. Gargle IV fluids, and this is sodium chloride with potassium 20 new equivalent. Is this correct? Yes. And the rate is 125 milliliter over an hour. Value to be included. Not 1,000, so I will put 980 just to make sure, in case the tube is not drying by then. Okay. Just gonna connect this to here. We'll cleanse again for 15 seconds. Are you okay? Yep. Okay, I start. And my clam is open.
That wasn't us, that was somebody else.
Oh, this is okay. Now it's open. Yes. It was closed.
Okay, bud. Ready?
Okay. It's good now. It's green. And it's running the sodium chloride and potassium chloride.
Okay.
Okay. So now I would document this really quick. Document the site. Right forearm.
Close your eyes. You ready, bud? After 15 minutes, sleep on it. So, 14 is not right. What happens after that? For how long? How long is, what happens from 14? Kicks in at 14 says fire. Like 14 you do it for 7 days, that's the 21. Then what? 35 seconds.
20 days. Right forearm.
To leave mud. Before you go one first. I know about it. Hey, where's the script at? I don't know. I thought you. That's the end. Oh, here it is.
That one was over there. I didn't have a room. A lot of them I good. Some of them,
No. Do the right.
no, but, well, I have it in, I have to do it. We're gonna turn the
This is beeping. So I want to check, make sure, the battery is low, so I want to.
No way.
Yes. So I plug it in.
That's so awesome.
You do like Cheddar Bob.
That's so awesome.
Alright. Are you ready?
I was so excited when I was like waiting.
Okay. You ready?
Yeah.
So I will need to scan you again. Can you verify your name and date of birth again?
Marta Yam. I'm 80 years old.
No allergy, right?
Oh, I don't have to do everything. I don't have to like.
So this is the antibiotic, the gentamicin. So I will compare to the MAR. Always check, make sure I got the right patient, right drug, right dose, right time, right route,
Mm-hmm.
and the expiration date is still good. No leakage on the bags. No discolors.
Mm-hmm.
Everything looks good. Okay, I scan the medicine.
Dude, what are you doing? I'm just supposed to approach, baby. Oh, yeah.
I won't take it. I'll have to type it in again.
It's not gonna be alright. Let's do this, ready? Okay, here we go. Hi, how's it going today? Hi, how are you? Good. My name is Chad. I'm one of the ones who. Good. My name is Tran. So, I was wondering if I could get an SR report from you. Sure. Yeah, absolutely. Patient's name.
Open top.
29. She's in here earlier today around 14, 15.
Spike the tubing. Make sure the two sides are sterile. Squeeze my chamber. Sure, is it closed yet? Okay. Prime tubing.
A little bit of background on her. She's widowed.
So I would hang my primary lower than my secondary. Clean the sides. 15 seconds before I connect the secondary. Now I'm gonna set up my secondary tubing. general select, secondary, and it's the gentamicin. It's right here.
Oh, the battery.
Okay, and this is okay. It's asking, is it correct? Yes. Okay. Confirm. Next. And the duration is 1 hour. So it's calculate my rate as 100 milliliter over an hour.
Okay.
Yeah. Everything looks good. So I will make sure my clamp is open before I click start. Okay.
Hi, Mr. Tran. How are you doing? I know I gave you that warning earlier today. On a scale of 0 to 10, what would you rate your coffee? Okay, wonderful. So I am going to give you your regular insulin today. You've been taking that before, right? Okay. Where do you normally get it for yourself?
In my stomach.
Okay. Last time you gave it in your right lower, so this time we'll give it in your left lower. Can you tell me if the signs of hypoglycemia?
No, I feel fatigued, lightheaded.
So if you start to get any headache or lightheaded with sad or anything like that, be sure to let us know so we can take care of it for you, okay? All right. And I also have some paperwork for you that I'll give you when I'm done that you can go over about your diet.
Okay,
And
start now.
later on today we can go over it together, okay?
Okay, it's green, it's good. We tell you that the gentamicin is running. Okay,
Okay, can you tell me your name and your age?
everything looks good. Are you okay? Yeah.
And do you have any allergies? No? Okay. Check.
Okay, the document over here.
And you have your food order? Yes. Okay, wonderful. Alright, so I'm checking the color, clarity, and expiration date. Yeah. That's good. Check against the norm, which is a little influence. I get the green light to go, and I'm good. Alright, so I'm going to be giving 16 units, so I'm going to pull that out in air first, and then inject it into the bottle, and then pull 16. So, Mr. Tran,
And you say you have no pain right now?
Mhm.
see if they
Yes,
can
because the
come in
doctor
and
Yeah, no
also
pain.
have some
how to change your dressing when you go home. So
morphine
later on
sulfate for
today,
you,
I'll
but
also
we
come
will
by and we can
administer
go together
because
if
we
you
have no
want.
pain.
Okay.
And you can show
Okay.
me,
So this antibiotic also it treats your infection, but it also have some side effects. It could cause make your lower your urinate output. It could make you have trouble passing your urine,
Okay.
or it may also cause hearing problem, breathing problem, or any and also allergic reaction. So
Oh.
if you notice any of that, just let me know, okay?
Okay.
Okay. So can you just tell me again what are the at least 2 side effects of the medication?
I could have problem with urinating, and the other one was there could be an allergic reaction.
Good, yes. And I also have some printout,
Okay.
this teaching
Okay.
sheet, so you can take a look.
Okay.
And then I'm gonna double check.
Gloves. Wash my hands.
So he's at 290, so this was 241, 315 minutes.
Gonna lower your bed, okay?
Okay.
You have your car light?
Yep.
Okay. Do you need anything before I go?
Nope.
Okay, I will be back to check on you about in about 30 minutes, okay?
Okay.
You want me to close the door for you?
Yep. That would be nice. Shoot.
That's it. Do you have any question for me?
I do. Sorry, just one second. Let me get my
Okay.
questions out. There was a few things I wrote down when I was in there. I was just wondering, were there any pertinent pieces of information you received before administering the client the medication?
Yes. I was always check to make sure the gentamicin was compatible with the normal saline. And I also checked that she has no allergy. And I also make sure I follow the 5 rights. Make sure it's the right patient, right drug, right dose, right time, right route.
Oh, okay. Did this information affect your decision to administer the medication?
Yes. So if it wasn't compatible, I would withhold the medication and contact my the provider to see if we can do anything else for her or administer a different medication. And I would also withhold the medication if she have allergic reaction to the gentamicin.
Oh, okay. I think that's all the questions I have.
Okay.
Thank you for letting me watch.
You're welcome. Thank you.
Mm-hmm.